I did a few mushroom trips before, and it really allowed me to look at things in like a different way. Like you're thinking about the same things, but you're thinking about them in like a different way. And even my friends have noticed that, like, when they're going through different struggles, they keep doing the same thing over and over again. And using and going on like a mushroom trip or maybe even some like LSD, it allows them to like look at something in a different perspective. So they're not repeating the same thing over and over and over again, because I feel like you have a link between like your actions and emotions and your memories. It's all linked to something. So you have like a bad memory, it brings out feelings of sadness. And I feel like sometimes when you do the psychedelics, you're able to maybe change how you feel about that certain memory or certain like thought process. So it seems to me like ketamine is very similar in the sense of like psilocybin, where you're going through a trip. So when people come to your clinic, are they going through like a trip, or is it maybe something less, like you said, like a microdose of psilocybin? Is like a similar feeling to that?
Yeah, we don't like to describe it as a trip per se. It's really, it's an experience for sure. They are altered. They are having this kind of dissociative or psychedelic-like effect. I think the word trip kind of is so commonly associated with recreational use or fun, or yeah, let's trip. Yeah, I'm tripping out. Let's go on a trip, whatever. So we try not to frame it in that way, but yeah, there's a lot of similarity there. It's not a microdose. It is a perceptible dose. You feel altered. For those who may not know, who are listening, a microdose really means an imperceptible dose, that you're not actually feeling very different from the amount that you take, which is commonly done with psilocybin, even though it's not legal in the United States for recreational use. And there's really not a lot of data behind it. We're just now starting to do some really cool research around psilocybin, and there's some great progress being made there. And it will probably be a clinical treatment in the next several years. But ketamine is FDA approved, and it has been for over 50 years. And it's available in a variety of settings in clinical offices today. So people can benefit from it legally with medical supervision. Whereas psilocybin has great potential, and anecdotally, I know that it has helped a lot of people, but they can't really legitimately work with the doctor on it. And then, of course, with doing anything that's on the black market, there's going to be risks as far as quality, potency, legal ramifications, etc., and safety concerns. So those are just some things for people to be aware of. But as far as what you're pointing out, the overlap and the ability to kind of reframe, reprocess, you're right on the money there. They both really promote neuroplasticity. They both promote, neurogenesis. They both can really help to disrupt these patterns, these negative ways of being, and give us an opportunity to kind of start fresh, which is really meaningful. And it's something we haven't seen in other treatments for mental health up until more recent times.
What I really like about ketamine, maybe you could share some more light on this, is when you think about the SSRIs or other medication we use for mental health, is you got to take that pill basically every single day. And at times it takes like 3 months for this SSRI to start working, like Prozac, all those kind of things. It takes time for it to start working, and it's like you're almost dependent every single day on this pill. So with ketamine, it's like you get it infused once every couple of weeks or once every couple of months. Is that how it works? So you're not so dependent on having this pill, and it's like, if I don't take this pill, it's going to kind of screw me over in the long run. It kind of means more of like a once in a while kind of medication, correct?
Yeah, so we do a series of 6 infusions over 3 weeks, and then it's as needed after that. So patients can go typically 3 months before they need any follow-up care, which is usually just 1 or 2 more infusions. It's not another series of 6. And that 1 or 2 boosters, we call them, can provide another 3 months of relief, sometimes longer. We've seen patients go 4, 5, 6 months or longer in between visits, and they're not taking any other medications, and they're doing great. A lot of people are tired of taking these pills every day. They're tired of the side effects like weight gain, loss of libido, dry mouth, blurred vision, increased suicidal thoughts, and a whole list of other really negative side effects. Ketamine has none of those. None of those side effects are present. And yeah, you're right on the money there, that for somebody who wants a more kind of holistic view of really trying to get more at the root cause of their issues and not just cover the symptoms, can really benefit from going through this experience and then coming back as needed to maintain their result and not being dependent on a drug daily. And ketamine works within hours to days. It doesn't take the 6 weeks, 8 weeks plus that these other medications take to come to a therapeutic effect. So people see results much faster, and they're not kind of stuck taking something every day that over time can really start to cause harm and also be very difficult to stop taking. As you know, when people are trying to wean off of these medications, they can have terrible withdrawal symptoms, and it can take a very long time. I mean, sometimes many, many months or even over a year, depending on what the medicine is and how high of a dose you're on. That process sometimes needs to be extremely gradual. We're talking about prescription pills right now, right? Before you can stop taking it in a safe manner.
So then, why is it that with ketamine you don't have to dose it every day like a typical SSRI? Is it because that breakthrough experience is just so strong where people can be fine with not going through it every day? Is it because it's not necessarily changing your brain chemistry and that's like the solution? It's the solution is more of like those breakthrough effect where you're changing your mind, so you're changing your ideas?
It's both. Ketamine really has a tremendous impact on both the brain and the mind while the medicine is in the system. And that effect lasts long after it's gone. With SSRIs and other prescriptions, they're only good once they've reached a therapeutic blood level, which, as we've addressed, takes time. And it has to be maintained. You're continuing to benefit from the drug while it's in your system. And as soon as the drug stops being in the system, you stop benefiting. That's because it really is covering more of the symptoms. Ketamine has these processes that we've described on the brain and on the mind that are profound, that are really meaningful, and they persist for months or longer. So that's some of the differences, both in changing the neurochemistry and also in changing the mindset for people to really start to have their lives back. And ketamine also has a very short half-life. The medicine is actually out of the body within, a matter of hours or a day. I mean, I think the half-life is around like 4 to 6 hours. So it's really like, it's not like the drug stays in the system and then, that is what's doing the work. It's what happens during the infusion experience that's meaningful and that has the staying power.